patients with heart failure, the Optimizer device is implanted in a procedure similar to an implantable cardiac defibrillator or pacemaker implant, with 2 commercially available pacemaker leads placed into the heart's right ventricular septum to deliver CCM therapy. Once activated and programmed, the Optimizer begins delivering CCM therapy to the myocardium via 1-hour therapy sessions scheduled periodically throughout the day. Basic studies performed in animals show that within minutes, the electrotonic signals spread locally and myocardial cells experience rapid changes in their biochemical activity, such as phosphorylation of key proteins and improved calcium cycling. In studies, this was demonstrated to lead to increased contractile force, with no increase in myocardial oxygen consumption. Further studies demonstrated that after several hours to weeks, myocardial cells reverse their gene program from heart failure fetal phenotype to normal phenotype, and local effects start to improve contraction at a global level. By several weeks to months, studies show observable beneficial effects throughout the heart using measures of ventricular function that may indicate a reverse remodeling effect. Optimizer is convenient for patients and is charged externally in a simple process that takes about 1 hour per week. Optimizer is backed by robust clinical evidence that includes outcomes such as an improvement in Minnesota living with heart failure scores of 11.7 points on average for patients treated with CCM, compared to the group receiving guideline-directed medical therapy. 81% of CCM patients improved their NYHA heart failure status by greater than or equal to 1 class on average, compared to 42% in the GDMT group. Additionally, CCM patients were able to walk 33.7 meters further on average than the GDMT group during the 6-minute walk test. CCM therapy is currently indicated for NYHA Class 3 heart failure patients that meet specific criteria. The Optimizer system offers a breakthrough alternative to alleviate symptoms and improve quality of life for heart failure patients.